probably the majority of you won't do this stuff. How do I know that? Because it's tough, it's challenging. Fat loss is not easy. Unless you're willing to make sacrifices and do exactly what you need to do, your results are gonna lack. That's the bottom line. I'm gonna cover the steps you need to do in order to get the body you want, okay? Some things to consider. Let's talk about fat loss. And this is a really oversimplified view of fat loss, scientific view. So let's consider two hormones that we have to consider when we're talking about fat loss. Weight loss kind of goes hand in hand there. One is insulin. Hi. The second one is catecholamine. Insulin is referred to as the storage hormone. We eat, insulin gets secreted by the pancreas, breaks down carbohydrate, shoves it to the muscle, and the rest of the body, whatever we need. Also helps shuttle protein to the muscles. Okay? And among other things. Catecholamine. Depending on the receptor it binds to on the fat cell, it can either help you, it can help mobilize fat. In other words, it'll help break down fat so it can go into the bloodstream and get shuttled to your muscle to use as fuel, so fat burning, fat metabolism. Those two things are very important to have active and inactive at certain times, okay? There's 3 steps to fat burning. One's called mobilization, the other is transportation, and the other one is oxidation. Mobilization is simply breaking down the fat from the fatty tissue, okay? Transport is getting it from the fatty tissue to the muscle, which is your fat burning furnace, the fat burning machinery, so to speak. Your muscles is what use fat for fuel. Oxidation, that's burning fat for fuel. Okay, to increase the mobilization of fat, a couple things have to happen. One, low insulin levels. Okay, so if your insulin level after a meal or after having a meal or even in a fasted state, fat mobilization can be 50% less if your insulin levels start to increase or at a higher state than a fasted state. So in other words, we want to follow a low carbohydrate diet to keep insulin levels stable. Okay? So fat breakdown impaired when you have high insulin. So what happens? How do we get high insulin levels? Does anybody know what that is? What happens? What has to occur for your insulin level to go up?
Something to do with sugar. No.
Sugar's one, but
Your pancreas isn't.
just by eating carbohydrate, and the type of carbohydrate really plays an important role there. Depends what's going to happen. So not all carbohydrates are created equal. There's ones we recommend, ones we don't recommend. There's a time where we used to recommend 6 to 11 servings of carbs or breads and cereals in a diet. That's wrong, okay? But avoid simple sugar. Your body doesn't know the difference between the two. The glycemic index is an index that tells you how fast after you consume a carbohydrate it reappears in your blood sugar. Guess what was used as the standard? White bread. It wasn't sugar, it was white bread. So any refined carbohydrates is going to act heavily on our insulin levels, even if it's wheat bread. Another myth. Okay?